Hi, this is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm very excited today to be talking to Bryce Heinbaugh, who is a risk management consultant with IEN Risk Management Consultants. They have 7 locations in Ohio. He is based in Ashtabula,
Yes.
Ohio. Up there near Lake Erie, kind of getting all that wonderful snow from time to time. He's one of 210 Health Rosetta advisors. And he's been touched by Dave Chase. Many people know Dave Chase in his recent book, Relocalizing Healthcare, which is actually how I ended up, long story short, connecting to Bryce. I read in the book about Allegheny County schools in the Pittsburgh area and the amazing project that they had there using the Health Rosetta principles to guide the school districts' health insurance plan. And through that, I learned about Bryce and the work he's doing in Ashtabula. And he told me a story the other day that I think you'll want to hear about how direct primary care and how the principles of the Health Rosetta approach are changing things for the better, dramatically changing things for the better in Ashtabula. Bryce, thank you very much for joining with me today.
Thanks, Larry. It's a pleasure to be here. I look forward to this conversation. I hope more than anything that it helps others. Maybe it's a physician that's really considering moving to the value-based model. It's a physician that just wishes that they could figure out how to gain business among self-funded employers. I hope to share with you how we've done it here in Ashtabula County, Ohio, and I feel strongly that you can replicate it just about anywhere if you have the right team. So happy to be here.
So take me back to the beginning. You obviously got your training through the Health Rosetta Project, working with Dave Chase, and tell me how you applied that in Ashtabula.
Okay, certainly. I'll take you back even a little further, just to kind of give everyone on the podcast an idea of my background. So again, I grew up in this neck of the woods, Ashtabula, if you're familiar with it, and it was on NPR in the fall before the election. It's a working class town, and I graduated high school here. I was raised in a single parent household, and at the age of 22, I found out I needed emergency open heart surgery. At that point in time, I was just finishing up my last semester of undergrad, and really didn't understand, the health insurance problems that I would face. And so inside of a year, 363 days later, I went out on my own, began my own firm, doing healthcare consulting for small businesses. And fast forward about 2 years after beginning, a good friend of mine who at the time was a part of Ohio University's School of Medicine, his name was Tom Campanella. Tom came to me and said, Bryce, I'm headed up to Cleveland, Ohio. I'm going to start to oversee the MBA, the healthcare MBA program at Baldwin-Wallace University, and I think you should enroll. And I said, well, Tom, I'm not quite sure I'm climbing a corporate ladder, but I'll listen to you for a minute. And so one conversation, he had me sold, and I entered into the healthcare program at Baldwin-Wallace. And among my 2 years of the program, I shook a lot of hands. And one of the hands I shook was a founder of a third-party administrator in Cleveland, Ohio. His name was Jim Farley. And Jim, from that point on, this was 05, 06, took me under his wing and showed me everything there is to learn about self-funding and stop-loss insurance and how to actively manage a healthcare plan for small to middle market employers. And so I got my start right about the time I left the MBA program in self-funding. And come to find out, Jim and I are very close friends. We talk almost every day. And if anyone knows Jim, he's early 70s. He's been around in this business for 40 years, has seen just about everything there is to see. But one of the things in 2017, he and I were talking about this guy, Dave Chase, who had a TED Talk on where healthcare has been really the largest legal wealth transfer in America. And he was coming out with a book, or had just written a book, The CEO's Guide to Restoring the American Dream. And so we were talking and talking, and then, a couple of weeks later, Jim said, "Hey, did you see Dave Chase is going to start an accreditation program for health advisors and consultants?" And I said, "No, Jim, I didn't." He said, "Bryce, that could be something to really look into." And why is because Dave Chase charges health consultants, insurance, I don't like the word broker, that's kind of status quo, but advisors or benefit consultants, he charges us with being some of the most influential people in America to systemically help change the way healthcare is delivered to employees and their families. And the reason why is because most of the time, your middle market CFOs or CEOs or COOs that are reviewing healthcare renewals, maybe they've not gotten the best advice over time, but if someone who had all of the right alignment, the removal of the misaligned incentives, the right advice comes to them and says, you can do it differently, then that CFO is going to make decisions about maybe 300 or 400 or 500 households on how the healthcare is going to be delivered at that organization. And boy, let me tell you, if as passionate as I am about this business, I know that I can help make that change. And so I joined Health Rosetta shortly after the accreditation program opened up. Have been a great, I guess an adopter of the model, Health Rosetta. My entire firm, we practice Health Rosetta 100% of the time. Like we are, no longer do we have the misaligned incentives guiding the advice or maybe the guidance that we're giving, but instead we're looking to help deliver this awesome, better health outcomes at a lot less cost. And so direct primary care is the fulcrum, in my opinion, it's the fulcrum as well as patient advocacy to the model. And so I'll stay quiet for a moment, Larry, and let you ask me a few questions. But Ashtabula County has been my first market that I've successfully begun to turn the tide with. And again, as a working class city and county, it is very meaningful and impactful financially to the employers, their employees and families, and the community. When you're talking a public school district not having to spend as much money, what can you do with extra dollars that otherwise would have been siphoned out of our small community and to big health systems and insurance companies? So I'll stay quiet for a minute.
Okay. So when we spoke the other day, you gave me a little background information about Ashtabula and about the county school district there that helped me to understand when you say it's a working class area. But give folks a little background about Ashtabula in the school district.
Sure. Well, again, when I say a working class town, Ashtabula County, depending how you look at it, good or bad, we are still considered a part of Appalachia, Ohio, all the way up here to Lake Erie. And it's we used to have what they called the roughest port in the world. Our shipping and all of our waterways here, we had a very large port. It was the largest on the Great Lakes at one point in time. But we had steel, from the steel mills to, manufacturing. And, again, like many parts of rural America, a lot of it had fallen away or fallen out. And we have a city of about 20,000 people. The county has around 100,000 folks. But in the city of Ashtabula, we are unfortunately a poverty-stricken city. And there are, from public housing to just the same problems, demographics, social determinants that you'd see in any larger city around the country, we have right here amongst this small population of 20,000. And so our public schools, just to kind of bring the perspective real, Ashtabula City Schools is actually, all the kids at the school receive, free a breakfast and a lunch upon arriving at school. And the state and our public school is paying for that because some folks go home on Fridays and don't have another meal. We have just a lot of obstacles. And so the healthcare of Ashtabula area city schools had come off some pretty high numbers year after year. And I had continued to kind of trickle this Health Rosetta information to the administration there, and I wanted them to really just listen. Just let you know, can I tell you a bit about how Allegheny County schools have done it? And again, just disclosure, I had nothing to do with Allegheny County, but Dave Chase, connected me to the folks down there that really headed up that consortium and the change that happened in Pittsburgh. And I started to follow some of the steps that they made. And one of the key pieces was they brought their unions together, and they had formed a union healthcare committee, and the purpose of it was to get the union to understand that they, with management or the administration, because of the healthcare industry, they're all sitting on the same side of the table, and the healthcare industry is on the opposing side of the table, because ultimately it's affecting from pay raises or lack thereof to the hiring or lack thereof of staff and the ability to offer extracurricular activities, et cetera. It was all going to healthcare, and so we'd spent a good deal of time working this strategy into Ashtabula area city schools and educating the unions there. And ultimately, what it came down to is I had asked the treasurer and the superintendent for an opportunity just to speak on an educational basis, not selling anything. I just wanted to bring the unions together to understand where healthcare has taken us, taken the schools, their own households over the course of a few years. And ultimately, I was fighting a status quo of a healthcare plan that really hadn't been changed in 15 to 18 years. And that means some folks were used to status quo and used to the way things had always been. And so it's really an entire mindset change that I had to go in and begin to have these folks thinking about healthcare in a completely different manner. And time and efforts, it's a big deal, but educating them on Health Rosetta, the fee-for-service business, by the way, the misaligned incentives of the healthcare industry. What is value-based primary care? What does it mean to actively manage a healthcare plan? And if the number one focus was achieving better health outcomes, what could you do with the extra dollars that would be left over that weren't going to the sick care system that was. And again, in 2019, Ashtabula area city schools had their most expensive healthcare year to date, which was a spend of about $10.5 million on 400 employees and their families. And if anyone does the quick math, that's, I think, about a $26,000 a year per employee per year benchmark, and it was terrible.
So when you say you brought people together, and I know in the Allegheny County school system, they created a consortium,
Yes.
and I've even had a chance to look at their website. Is that something that you did with the folks, the labor and the management folks in this school district?
So Larry, I wouldn't say that our strategies were as grand as that, bringing a consortium together. We did bring the unions together, and again, certified and classified folks in the same room, and we're working together even with a number of folks in the room. But ultimately, what I had to do, and this is why I believe that Health Rosetta and Dave Chase and those folks would say, Bryce, you overcame about every barrier you could have had, but we pulled them out of the Ohio School Board Consortium, or OSBC, after I don't know how many years they had been a part of that OSBC. And even with the warning, Larry, that if you leave the OSBC, we will not welcome you back. And that's a big, that was a big wall. I mean, the treasurer said, Bryce, in the unions, are you sure? Are you 100% we're doing the right thing? Are we, there's no going back. We've been with this consortium. I want to say at the time, Larry, there may have been about 50 schools across the state that were members, maybe even more. But ultimately, I had to, with confidence, say, yes, we need to do this. Our data analytics, by the way, the very first step we did was begun a disease management program, started to get the real-time claims data, and predictive modeling, and we got to see the disease state inside the school district. How many diabetics, how many cancers, what were we looking at in the next 12 months ahead of us? And when we started to see the data and the disease states, that is when, and here's the ticket, the very first cost containment strategy we employed, before I even took the district out of the consortium, they agreed to implementing direct primary care on a capitated value-based model. And at that step in the right direction was what I would say, was the prelude to unbundling, moving them out of the consortium in the middle of COVID, during a time when there was much uncertainty across the country and no employers wanted to make any changes. August 1st, 2020, we moved all 400 employees and their families onto the Health Rosetta model full on.
Why don't you mention the name of the physician that
Sure.
you worked with?
Yep. So I'll allow me to kind of drill down on this. So again, every private practice physician in this town unfortunately had to either sell out or go work for one of the major hospital systems in Northeast Ohio. And I don't need to name the names, but ultimately, if you know anything about Ohio, our area. But this physician he was the last standing primary care physician in this town before selling out. He had a private practice for about 18 years, sold out, signed a 3-year contract, and quite honestly, his patient panel, before he decided to, let's just say, retire, before he left on retirement, his patient panel, they moved him to 3,100 patients. And he was sick and tired of being sick and tired. A well-established, been in practice, I think his entire career is almost 40 years span. He decided to hang it up. And I happened to catch him. He and I didn't know each other, but we have a nice gastronomy district, some great restaurants here in the historic district. And he and I passed on a Friday night in a restaurant here in town. And I said, Doc, and his name, Dr. Jim Lambros. I said, Doc, you don't know me, but I have a conversation that I'd love to have with you about an opportunity that could forever really change the way you're looking at either retirement or whatever you're doing. And he and I sat down probably within 2 weeks. And we sat down and I laid out this value-based primary care model on a revenue side called direct primary care, where he wouldn't be taking any insurance, no Medicare, not having to deal with any of that gobbledygook. And I said, Doc, my most immediate need is I need this DPC to be launched immediately for my public school district here in town, in which he is an alumni of, which is his Hall of Fame pictures on at the lobby wall. I said, Doc, we could change the way healthcare is not only received, but delivered, and health outcomes can improve with this one little strategy of direct primary care, having you go on site to the schools. And in this case, because of the number of employees, I'd like you there twice a week. And by the way, Doc, I've got a couple other clients, a chemical company, a manufacturer, et cetera, that under this value-based model, Doc, I believe that I can hit your capacity of 500 to 600 patients, and I could probably do it within 12 months, all on a capitated rate. And you do medicine the way you were trained and the way you like to do it, 30, 60-minute visits, and let's see if we can turn the health of the population around. He said, Bryce, this all sounds great, but man, I don't even know where to get started. I said, don't worry about it. My connections with Health Rosetta, they're going to connect me. I went out to San Francisco on my own, met the practice software that he uses today. I kind of vetted the people out there called Hint, and they handle all the billing to the employer and the electronic medical record, the EMR system that talks to Hint, and then the telemedicine app, Spruce. We came back, I said, Doc, I laid it out. I met with a couple physicians out at the Hint conference. This guy, Dr. Eric Kroll in Tampa, Florida, he laid it all out for me. He's willing to help us, no charge. He will talk to you. Let's Zoom him in. And within 90 days, Larry, we were up and running on a on full go with all the software, all the technology that we needed to efficiently launch our direct primary care program amongst my clients here in Ashtabula County.
So just very quickly, I'm going to put you on the spot a little bit. So
Sure.
when did this happen? When did you launch the DPC practice?
Yep, we launched the DPC practice December 1st of 2019. So it's just a bit over, a year and a half
Right.
now. Yep,
Right.
and that was in the schools, December 1st, 2019. And then obviously COVID hit, but thankfully we did it. The timing was beautiful because of his ability to handle patients that were all very fearful. They
Right.
had him on telemedicine. They could text him, "Hey doc, I'm not feeling well. What do I do?" etc. Perfect timing.
And I know that you're not comfortable claiming success, dramatic success, but you have some very interesting positive numbers that you can share. So what's been the positive impact to date?
Yep. So to date, now again, it is hard, and the reason that originally when we spoke, Larry, when you were doing your fact finding with me, it's hard to measure how much COVID played a role in this in terms of slowing down claims. But we also know the amount of patients that have been seen, the ability to, really, Doc's been able to improve some health outcomes of folks. We've even gotten some of our health. We've got functional medicine health coaches, but we've been able to employ our team and our nurses. And I will say to you, we're seeing, for like the school district, numbers, 15-20% below budget, that where they had been to where they are today. Our other local manufacturing company and the chemical company are seeing the same approximate numbers as well. The direct primary care physician, Dr. Lambros, has really just become like the go-to. And what I will say to you, we know it's working, and we know the word is spreading like wildfire, because the uptick, typically every time I've done a DPC implementation from scratch, that first 90 days, we get about 30% of the eligible population to agree to and sign up for the doctor, 30% of that population. And we did, we saw that with every one of those employers, but within about 180 days, we started to see it go 40 to 50%. And within 12 months, we actually cleared over 500 members. I, again, call them members or patients to his practice. Just through, I believe, today, Dr. Lambros has 3 of our local self-funded employers on direct primary care, including the school district. And so that downstream hospital revenue, that fee-for-service misaligned revenue model, we're taking a bite out of it, and the patients are getting better care, more time with their physician.
Now, my understanding, Bryce, is that his panel is now full, and you're seeking to recruit another physician.
That's correct. As a matter of fact, we just met with I am delighted to say, a brand new value-based DPC doc in Beechwood, Ohio, outside of Cleveland, and she is, again, she's from out west, but did her medical school in Florida, came back to, I think, did the residency at Cleveland Clinic, and then right out of the gate decided, I'm not going to go part of that fee-for-service model. I'm going to start a DPC practice, and we just met her, vetting her, and needless to say, we're gonna bring her in to a couple of our clients. And then in Erie, Pennsylvania, which I believe, Larry, you know of the Isbicki brothers, Dr. Harry and John Isbicki. We have just brought them on. We spent about the last 4 or 5 months vetting them, making sure we had all the alignment that we needed. We're bringing their practice on board with our first self-funded employer in the Erie, Pennsylvania, and then hopefully can feed them even more in the very near future. So we're seeing this growing, and I can tell you, not only is it growing, but again, that when I say we're achieving better health outcomes, we're impacting these people's lives in a way that the thank you cards and the emails thanking them for either the DPC doctor or our concierge nurses that are working closely with the doc and our community pharmacists right here in Ashtabula, the last standing community pharmacist who we've written into every one of our self-funded plans so that she and our DPC and our nurses can all work together to achieve better health outcomes. We've got a great community health plan started, and I mean it's going.
Right.
It's so exciting, Larry, to tell you. Last Friday, this was between since calls with you, but we have actually had the good news to say that the city of Ashtabula is hiring us now to take them to the promised land as well. Health Rosetta, and if all goes well, direct primary care with one of our new DPC docs, since we're obviously at capacity with Dr. Lambros.
Right. So I think it's pretty cool that Ashtabula, Ohio, may become the first community to fully embrace direct primary care and its potential.
Yes, and to tell you, a lot more is coming, but we've sat down. We've had multiple meetings with the actual county government as well, with one of the largest self-funded plans in our county, all the county employees, and the county commissioners are still considering moving to direct primary care, hiring us as their consultant, moving to direct primary care. And if that happens, Larry, the cards just continue to fall to this great model, and we start really taking back what healthcare has been taken from us.
That is fantastic. So, Bryce, what's your? I'm going to bring things to closure here.
Yep.
What's your what's the biggest learning for you?
Yep. So I'll say this again, because of the demographics of where I'm located here in Ashtabula, Ohio. I'm finding, we just launched a DPC program at an employer group in Lakeland, Florida. Now this is Central Florida between Tampa and Orlando. Again, similar social determinants, same, obstacles, but we've got a great DPC practice that went into an auto dealer down there. We have over 50% of their population enrolled in less than 6 months. This is big time for us. But parts of the country that are rural or access to high quality care has been a learning experience for us because we're unable to find DPC solutions. And I told you the fulcrum of this model, I believe, from everything we've been seeing, is DPC and working with our nurses in the pharmacy and our Center of Excellence program for high-end specialty stuff. Well, the state of West Virginia, as I said to you when we first spoke, Larry, I've got a really great footprint happening in West Virginia. We've had some great things happen. We've got some clients down there. And right now, finding direct primary care for a rural area that needs it most, that really needs it most, it's hard to go into a new market or a rural market not knowing high quality with the right incentives, the right alignment, physicians that can do what we need to do with care and chronic disease management, working with our team and really getting out of that fee-for-service mentality.
So there's one thing I would like to clarify, Bryce. When you're talking about your relationship with Dr. Lambros, he is running his own DPC practice, correct?
That's correct.
And he's in relationship with you, but you don't own his practice.
I have no financial stake or incentives, nothing at all with Dr.
Okay.
Lambros. Now and again, if there was anything at all, I'd go have a coffee with him and maybe he'd buy me a coffee, and the next time I'd buy him a coffee.
Sounds like a good deal. Sounds like a really good deal.
Yeah.
Well, Bryce, I want to compliment you on the work that you're doing. I've been involved with the direct primary care movement for a long time, and there's a lot of DPC practitioners across the country who've been trying to talk to employers, and quite honestly, a lot have struggled. And I think someone with your skills and knowledge of insurance can speak to employers on their behalf And this relationship you've developed with Dr. Lambros is just a wonderful example of how that might happen.
Yes, I think, thank you for the opportunity to make a closing statement here, because let's leave the audience with this. I believe, and one of the things that I have learned is physicians have struggled. They maybe just not sure how to articulate the language to a CFO, and you know, they're maybe perhaps trying too hard. But what I'd like to say is they really should look at the Health Rosetta cohort of advisors, find one nearest them, and reach out and try to work some sort of a you know, an opportunity. I'll talk to physicians around the country and I'll just say, hey, do you serve on any local boards? Are you at perhaps a country club where you've got some entrepreneurs or C-suite folks that you could just open the door? You don't need to try to sell anything. If I have a conversation with them for you on your behalf, you're a solution set for me every time. And so I would say to some of the physicians that may be listening is look for well-aligned Health Rosetta advisors and let them do the talking, because I believe as if you look at the Rosetta model and the 7 or 8 tenets to the model, DPC is right in the middle, and it does all of what we need to do for risk mitigation and the chronic disease management for our employers.
So one of the things that happened in the Allegheny County School District story is they saved enough money that they were able to invest in their teachers, increasing their teachers' compensation, which obviously is something that's really important for the future of not only our children, but the future of America. You think that's in the offing in Ashtabula?
Yes, I believe so. Now, I will say humbly, we like to call it the Health Rosetta Dividend, because if they adopt this and do the change that we advise, when there's those extra dollars, and it may be a few $1 million, it may be a few 100,000, but we like to suggest and recommend, maybe it's pay, but maybe we like to use those words, social determinants of health, but we like to educate those C-suite folks or the leaders of a public school district on proper nutrition, pay, education, safe neighborhoods, clean drinking water, et cetera, so that somehow, some way they can give back those dollars that we've kept on hand in a way that will further the health outcomes of their population that otherwise they could not have.
That's great. That's great. Well, Bryce, thank you very much for talking with me today. And when we put this, in fact, why don't you just go ahead? Do you want to mention your email address if people want to contact you?
Sure, I can do that. Yep. So by the way, our website is www.ienrisk.com, ienrisk.com, and my email address is Bryce, BRYCE, @ienrisk.com. And again, if you email me, I do promise that it will remain on my inbox until I can respond. But I do respond to almost every email I can, and certainly happy to have any conversations with any physician that's interested in, you know, building out a market, especially if they do have some influence to either employer groups, organizations, both public and private, to just start a conversation with. I can help them at least, you know, I believe help influence those conversations.
Bryce, thank you very much. Thank you for what you're doing for your hometown. Thank you what you're doing for America.
Thank you very much, Larry. It's been a pleasure. And again, I'm obviously, you can tell I'm passionate about doing this. I got a lot of years ahead of me, and we're going to continue to pound the pavement.